Thank you very much. Is this on now? Okay, thank you very much for having me here this morning. I have been talking about women and heart disease for many years, and I think finally I'm seeing the attention that people are paying attention to heart disease in women as it really truly deserves. Today we're going to go over some definitions. What is heart disease? Well, the heart is basically the hardest working muscle of the body. It pumps around 4 to 5 liters of blood every minute during rest. And it supplies basically nutrients and oxygen to all the body parts. Now, when they talk about coronary arteries and coronary artery disease, coronary arteries are basically the arteries that supply the heart with blood, and this nourishes essentially the heart. There are 3 major arteries in your heart. You have the one that supplies the left side, the left anterior descending, the left circumflex artery, and then you have the right coronary artery. And don't worry, I'm not going to quiz you later on this one. So on the top side of the screen, on the right-hand side of the screen, is what we call the normal artery. You see, the artery is nice. There's no cholesterol plaquing around the artery. And then if you look at the bottom left side of the screen, this is what a narrowed artery is. Essentially what happens is that cholesterol plaques start to form inside the artery, causing a blockage in the flow or an impedance in the flow of blood. Over time, we call the fatty deposits your atherosclerotic plaques, and it builds up in the artery, causing the artery to become a little bit narrow. And this is what we refer to as the process of atherosclerosis. If the plaque affects the coronary arteries, then we refer to it as coronary artery disease. So the myth is that people think that a heart disease is a disease of the elderly. You know, you only get it when you go old. But as a matter of fact, it is the disease of the youth that manifests itself in adulthood. So when they did autopsies in 10-year-old kids who had died of other reasons, and they looked at the coronary arteries and they looked at their aortas, the first sign of plaquing, of cholesterol plaquing, was already evident in these children. So it starts early on. So, you know, if you have kids or grandchildren, it shows what the importance of modifying the way you eat and dealing with your risk factors early on. And this is the reason why the recent guidelines suggest that even children by the age of 9 or 11 should have their cholesterol checked, because you don't want them to have a problem like this in the future. Now, how big is the problem? Coronary artery disease is the leading cause of death worldwide. It's the leading cause of death in the United States in both men and women. And 1 of every 6 deaths in the United States is secondary to coronary artery disease. It kills more patients than all cancers combined. Around 17 million Americans live with coronary artery disease. What are the myths as it relates to women and heart disease? Well, you know, women have always thought that breast cancer was their #1 killer, that cardiovascular was a man's disease. That's why we used to refer to it as a widow maker and not a widower maker. People also used to think that the risk factors are the same for men and women, and the symptoms are the same, and women are medically treated the same as men. And if you listen to my talk today, you'll find out that these are all myths. The truth is, cardiovascular disease is the #1 killer of women beginning the age of 45, that more women have died of cardiovascular disease each year since 1984. It's estimated that 100,000 more women this year will die compared to men of cardiovascular disease. There's some risk factors too that are different. You know, even if it's a risk factor for men and women, it affects women differently. You know, it's more dangerous in women, like diabetes, and we'll go over that later on. And the sad thing is that women often tend to neglect their risk factors. Cardiovascular disease develops differently in women than compared to men. Now, you know, the American Heart Association, the Go Red for Women, speaking of women's health, they've done an incredible job raising awareness among women that heart disease is the #1 health risk. The problem with women, though, is they always think it's always going to be the other person, not me, going to have heart disease. So they never personalize the disease. If you're looking around the room and if you look at the person beside you, one of you will develop cardiovascular disease in your lifetime. So your risk of developing heart disease is 1 in 2, as opposed to 1 in 8 for breast cancer. And as I told you earlier, the mortality rate for cardiovascular disease is more in women. The red graph here points out the mortality rate in women, and the blue graph is the mortality rate for men. So when you look at the population in the whole, there is a reduction. So we've done a good job reducing death from cardiovascular disease for the United States. Over the decade, it's gone down by 28%. But when you look at who's actually dying for cardiovascular disease, there has been a reduction in death from vascular disease for men, but it continues to rise among women. And so this is the problem that we really need to address if we're going to reduce the risk of dying from cardiovascular disease in the future. So what are the differences in heart attack outcomes? We always talk about cardiovascular disease as being a preventable disease. And the reason why is 64% of women, their first presenting event is sudden cardiac death. So when they don't know that they have a heart attack, they never get the chest pains, they never get angina, they present basically with sudden cardiac death, as opposed to 50% of men. The mortality rate, so the risk of dying after a first year of a heart attack, is around 38% for women compared to 25% for men. And the statistic is worse among women less than 50 years of age. So if a young woman comes into the hospital with a heart attack, she's twice as likely to die of that heart attack compared to men. What are the differences in risk factors? Well, the LDL cholesterol, it's now not enough to know what your total cholesterol level is. You need to know the breakdown of your cholesterol, and you need to know your numbers. Your LDL cholesterol is your lousy cholesterol, and you want to lower that. Okay, so L for lousy. It is less predictive of cardiovascular disease in women compared to men. Now, high triglycerides and HDL. HDL is your healthy cholesterol, okay, and you want that higher. So low HDL levels, so if you have a low level of your healthy cholesterol, this is a very strong predictor for cardiovascular disease in women. Diabetes, as I told you, diabetes is a deadlier risk factor for women compared to men. It increases your risk as a female of cardiovascular disease by around 3 to 7-fold as compared to only 2 to 4-fold in men. And the elevated C-reactive protein, and we'll go more over this. C-reactive protein is a marker of inflammation that you have in your body system. And if you have cardiovascular disease, it tends to be higher. This is more predictive in women compared to an LDL cholesterol. Yet, not everyone gets their C-reactive protein checked. A lot of it is because the insurance company doesn't pay for it. But in women, it turns out to be a stronger predictor for cardiovascular disease compared to the LDL cholesterol. So, and there are gender-specific risk factors. When you're pregnant and you had what we call gestational diabetes or gestational high blood pressure. So if your blood pressure or your sugar level goes up when you're pregnant, you're more likely to develop cardiovascular disease in the future. So these are high-risk patients. The other thing, too, is that during your productive years, if you had irregular menses, in other words, you would, especially the people with polycystic ovarian disease or syndrome, they skip menstruations months at a time, their estrogen level tends to be lower. And we've identified this subgroup of patients who will eventually develop cardiovascular disease in the future. So even during your productive years, we're able to identify high-risk women who may eventually develop cardiovascular disease. Now, one of the important things besides the risk factors is really knowing what your symptoms are. I've had patients time and again, women who sit in their homes because they have this terrible indigestion or they feel so fatigued and they think nothing of it. Finally, they go to the emergency room after a day only to find out that that was their symptom of a heart attack. But one of the things that you have to be aware of is that most patients will have what we call the typical symptoms of heart attack. And what we say, we describe that as a heaviness in the middle of your chest, that is precipitated by walking or exertion and relieved by resting or taking nitroglycerin. The issue with women is that there is a greater proportion of women who will present with what we call the atypical symptom. So they're more likely to have chest discomfort when they're sleeping or during mental stress, or they can have the pain elsewhere. You know, it's common for women to have jaw pain or neck pain. Sometimes they have it in their arm or their stomach or their back. There are also there's some atypical symptoms as well. I had a patient who came to me just telling me that she could no longer vacuum her house when a week before she did. So easy fatigability, being very tired or being very short of breath doing anything or of their housework, to her, that was her symptom for cardiovascular disease. So if there's anything wrong and you feel that there's something wrong, you know your body's more than we do. And if you think that you're not able to do what you used to do a day ago because of this fatigability, this profound fatigability, you need to let your doctors know, because in women, that could be a sign of cardiovascular disease. As a matter of fact, they've looked at and studied this, and when people who come in with heart attacks, so these are people who are seen in the emergency room who have documented heart attacks, chest pain and feeling sweaty were more common in men. And what women had were back pain, jaw pain, they felt nauseated, they had neck pain, and they had shortness of breath. So these were people who were actually having heart attacks. Now, there's a concept that's coming out there that we think that the plaque distribution in women may be slightly different from that in men. So your upper illustration illustrates the typical plaque formation that you see in men. You know, we're in the plaque, which is the yellow cholesterol plaquing. It's the yellow diagram up in the upper diagram. Basically, it shows a narrowing right in the middle of the artery, and that artery is maybe around 90% blocked off. When women develop their plaque, it's a little bit more evenly distributed. So when they do a cardiac catheterization in women, they say, you know what, her coronary arteries were completely normal. You know, even if she's having chest pains every day, we did the cardiac catheterization and it's fine. Well, the reason why is because the plaques in women tend to go outward and it's more evenly distributed. So when you do a cardiac catheterization, it seems like, well, the only thing wrong with her artery is that her artery is small, but she doesn't have coronary artery disease. Now, that has a very, very great implication, because the treatment of your risk factor depends on whether you have coronary artery disease or not. And so if you tell me, and I just did a cardiac catheterization on you, and the other doctor tells me, well, you know, her coronary arteries were completely normal, then I may not be as aggressive in bringing down your bad cholesterol or in raising your HDL cholesterol, which is your healthy cholesterol, compared to a man who has the typical blockage that you see in the cardiac catheterization. And the most recent studies have shown that even patients or females who've had cardiac catheterizations and were told that they have normal coronary arteries, they have an increased risk of having a cardiac event 10 years down the line. So you have to, you know, if you have persistent chest discomfort, you need to see a cardiologist who knows women and knows the problems with women and heart disease, because you need to be treated differently. And one of the things, too, that we've always said is that, well, once you have coronary artery disease, are women treated the same way as men? Well, as a matter of fact, it's not. We're saying that more women die of heart disease, more women have congestive heart failure, and more women develop cardiovascular disease as they get older. Yet, when you look at all of the angioplasties and stents and bypasses that's done in the United States, only 33% of women receive it. The rest are men. So of all the stents that's been done there, of all the pacemakers and defibrillators, open heart surgery, there's really a smaller proportion of women who receive this treatment that has been known to be really life-saving in women. So there is a difference in treatment as well. Now, how do you reduce your risk? Well, first is being aware that heart disease is your #1 health risk. You know, you need to personalize it and think that, you know what, if I don't change my habits at this point in my life, there's a big chance, there's a 1 in 2 chance that I will develop heart disease in the future. The other important thing is knowing your numbers. You know, if you don't know your cholesterol at this point, you're almost too late, okay? You need to know what your bad cholesterol is. You need to know what your good cholesterol is. You need to know what your triglycerides, blood sugar, blood pressure is. These are all very important numbers to know. And it's not enough to do it just once, okay? You need to do it yearly. You need to know the symptoms of heart disease and heart attacks and strokes. And if you know or think that you are having a heart attack, do not hesitate to call your doctor, to call 911. And you have to implement the heart healthy habits. You know, what we've told patients is that if nobody smoked, everyone exercised, if you ate heart healthy meals, and if you're not obese, you can reduce your risk of developing heart disease in the future by 92%, which is better than any medication that I can give you. So what is your goal? So these are the numbers to remember. Your blood pressure, you want it lower than 120/80, okay? Your bad cholesterol, who knows what the difference between, what do monkeys and toddlers and infants have in common? They never have heart attacks. Monkeys never have heart attacks, unless the ones that are fed fat, but they never have heart attacks. And you know what other thing they have in common? Their LDL cholesterol, which is their lousy cholesterol, is less than 70. Okay? And I bet you in this room, there is none of you that has an LDL cholesterol of less than 70 if you're not taking cholesterol medications. So very important, LDL cholesterol. Your HDL cholesterol, which is your healthy cholesterol, needs to be above 45. Your triglyceride needs to be lower than 150. Your fasting blood sugar, which indicates whether you're at risk for having diabetes, should be less than 100. And your BMI, which is your body mass index, has to be less than 25. Now, the body mass index is basically your weight over your height. And, you know, if you're like me, I need to get into the computer, plug in the numbers, you'll be able to get your BMI. And your waist circumference, you know, it doesn't matter if your fat's in your hips. It may not look pretty, but the fat in your hips doesn't go to your heart. The fat in your belly does. And that's why we pay close attention to your waist circumference, and you want that to be less than 35 inches. So what I wanted to do, you know, for the second half of my talk is to give you some dietary tips. Unfortunately, before I do that, I need to give you a little bit of a lecture, which is, believe me, the terms sound really scary, but it's really not. First, you need to know the concept of postprandial dysmetabolism. Sounds like a big name, but basically what it is what happens to your sugar level and your triglyceride level after a meal. And after any meal that you eat, like the meal that you've had today, your glucose level and your triglyceride level will go up, regardless of what you eat. However, when you have meals high in refined sugars and saturated fat, what happens is actually an exaggeration of this natural event that happens 3 times a day. So your glucose increases and it goes over the chart, your insulin level increases, and your triglyceride level increases. What does this extra glucose and fatty acid do? Well, when you have this extra glucose and extra fatty acid or triglyceride in your bloodstream, unfortunately, it releases some free radicals. Now, free radicals is really a bad thing. They cause cancer, they cause coronary artery disease. They're basically unstable cells that just want to move around. And for it to be stable, it needs to bump into one cell to stabilize it. And that causes inflammation in your cells and in your arteries. It causes your LDL cholesterol to be more aggressive because it becomes oxidized. It causes your arteries to constrict, and it causes your blood to be more prone to clotting. So imagine having a refined meal 3 times a day. So you're doing this 3 times a day in your regular day, you're doing it 3 times. Elevated blood sugar after a glucose challenge. So if I gave you a meal that's rich in glucose, if you have an exaggeration in your glucose level 2 hours after that, it increases your risk for having cardiovascular disease and developing diabetes, and all-cause mortality as well, okay? If you increase your saturated fat intake, what it does, it increases your triglycerides, and this also has been associated with cardiac events, okay? Now, I figured I'd throw in this slide to explain to you more easily what's happening, and I thought that was a simple slide. I was just kidding. I can't, to this day, I can't get that slide, so I just put it in there. So basically, you see two graphs. The graph on top basically tells you that after a meal, the red one, which is your glucose level, goes up after 2 hours, and the blue line is your triglyceride, and it goes up over 4 hours. Okay, so that's the natural reaction to a meal. Now, what these smart scientists have done is said, well, let's see if your inflammatory markers or the inflammation in your bloodstream goes up. So they took that bar there is your C-reactive protein, and your nitrosin is the red bar below it. And you see that that goes up. So it does confirm that after a meal that's heavy in glucose and fatty acids, your inflammation in your arteries go up. Okay? And that blue line or green line that goes down is actually the marker for the ability of your arteries to dilate. And you see that the arteries are not dilating as well or as good as it should be. So this translates into things that goes on in your body every time you have a meal. And it's kind of scary if you think about it, because they looked at patients whose glucose level rises significantly after a meal, and these patients actually have a progression of their coronary artery disease. So the plaque in the arteries actually progress when you have high glucose level. And why is that? Well, it makes you more prone to developing diabetes. That's why. Okay? But if your sugar level remains low after a meal, there is actually a chance that your the plaquing in your arteries can regress. And so you've been through all the diets. I mean, how many of you have not tried diets at all in your life? Yeah. Well, that's very good if you've never tried diets. But I am going to go over, there are literally hundreds of diets out there. Okay, hundreds of, there is an earth diet, and there is a hacker's diet. And I don't know if that has anything to do with computers or anything, but there is, of course, you know, the low-fat diet, the macrobiotic diet that doesn't cook anything. There's even a prisoner loaf diet, and I don't know if they eat anything in prison, but there is a diet that's, and then the smart fry. One of the things that we have to remember of diets is that diets basically, it's calorie in and calorie out. So for example, you exercise for an hour, and you lose 600 calories and you feel so good about yourself because you've lost all these calories, and then you go to the donut shop and you eat one donut that has 1,000 calories in it. Well, forget about the exercising. You might as well, you know, because you have only wasted 1,000 calories, and you have eliminated 600 calories, but you put back in 1,000 calories, so you're positive 400. So that's what diets are. So any diet that's going to restrict your calories is going to make you lose weight, okay? The problem with these fad diets is that they're very difficult to follow. I mean, any one of you who's, and believe me, I've tried all the diets. Before I recommend it, except the prison loaf diet, I've probably tried all the diets. And believe me, you know, the problem is that any one of you who've been on the South Beach diet where you lower your protein, you lose 20 pounds in 3 months, and then you stop doing the diet, you'll gain 60 pounds the next 6 months. That's the problem with the diet. It's very hard to maintain. The best way to really lose weight is to have your stomach stapled to your upper lip, but we haven't figured out a way of doing that yet. When we have, we'll let you know. Now, as cardiologists, one of our favorite diets is a Mediterranean diet. And you know, we've discovered this many years ago, that people in the Mediterranean, in Greece and Italy, they like good food, they like good wine, yet their cardiovascular disease rate is very low compared to Americans. And this is just, you know, basically the difference between the USDA pyramid, which is the American diet, and you have the Mediterranean diet. And don't worry, we'll go over the components of the Mediterranean diet. And the reason why we mention this all the time is because we actually have data backing up this diet. You have the Lyon diet heart study, and wherein they took 605 patients who've had heart attacks. So these are the worst patients. They've already have cardiac events. They're high-risk patients. And they were randomized. Half of them did the Western diet. And this wasn't even the bad diet. You know, you're not talking about the McDonald's diet. This was an American Heart Association recommended diet. And then the other half had the Mediterranean diet. And you know what they found out was that after 7 years of following these patients, there was 70% less heart attacks in the group that stayed with the Mediterranean diet compared to the American diet. 70%, okay? Do you know how well your medications work in preventing you from having a cardiac event? They will reduce your cardiac event by 35%. So this diet alone is better than any medications you have, okay? And what are the components of a Mediterranean diet? Well, you know that they're very abundant in using olive oil for cooking and dressing. There's an increased consumption of fruits and vegetables and beans and fish. They really limit the meat intake to maybe once or twice a month, and they want you to use maybe the healthier or leaner portions of the meat instead of red or processed meat. They prepare a lot of their homemade sauces with tomatoes and garlics and onions, and of course olive oil is a mainstay in any of the food that they prepare. They avoid butter and cream and fast foods and sweets and pastries and sugar-sweetened beverages. And in alcohol drinkers, moderate consumption of red wine is allowed, and we'll go over that. I know you have a lot of questions about that, so we'll go over that later on. So let's go over my number 10. Fish and fish oil, you gotta eat it, okay? Your fish oil reduces your triglyceride levels. Remember how I told you elevated triglyceride levels is going to cause all of these free radicals or bad cells to form? Well, your fish oil reduces this. We've seen it reduce abnormal heart rhythms. Fibrinogen and platelets are the components in your blood that tend to make your blood clot, and it decreases this level as well. It reduces your blood pressure. It improves your arteries' ability to dilate. It improves your mood. So they've actually tested it, and people who ate a lot of fish or took fish oil actually were less depressed. And it really reduces your cardiovascular events as well. What are your sources of fish oil? The marine sources, basically you have the tuna, sardines, salmon, herring, trout, and cod. We like women, particularly pregnant women, to avoid shark, tilefish, swordfish, and mackerel for obvious reasons, because their mercury level is a little bit on the high side. If you don't like fish, going with your fish oils is good enough. But one thing that you have to remember, the fish needs to be baked or grilled. If you fry it, you remove the benefit of the fish oil. So any one of you who likes the fish and chips, doesn't work for you, okay? Now, there are several, and you probably are going crazy as I am, because there's so many fish oil formulations out there, and you know, you always are asking yourself, well, what do I choose? What do I have to choose? The important components of the fish oil is your EPA and your DHA. These are the two components that's actually been shown to be beneficial for the heart. The differences in your fish oil is the component or the ratio of this good fatty acids in the capsule, okay? And the FDA-approved capsule obviously has a higher percentage of this good fatty acids. So Lovesa, which is the only one that's FDA-approved right now, has 90% of your EPA and your DHA, okay? If any of you have taken fish oil, one of the unfortunate side effects of fish oil is that you feel bloated, you're nauseated, you sometimes burp like a fish. One of the things that you can do to avoid this is storing it in the freezer. So one of the medications that you put in the freezer to avoid the bloating that you get from fish oil. We have studied fish oil in maybe 100,000 patients, and these were patients who have cardiac events. And the current American Heart Association guideline is, if you don't have documented coronary artery disease, get 2 to 3 helpings of fish per week. Okay, plus maybe one of those fish capsules. If you have coronary artery disease, you need 1,000 milligrams of that per day, okay, which is 1 capsule. But if you have coronary artery disease and you have increased triglyceride levels, so some of you who are seeing doctors, maybe they're prescribing 4 capsules, because that is the current recommendation, around 2 grams to 4 grams or 2 to 4 capsules a day. But it does a lot of great things. It reduces the inflammation in your blood. It reduces the stickiness of the blood vessel. Lots of beneficial things for fish oil. So fish and fish oil, go ahead and eat it. Vinegar, this is my number 1 tip. Vinegar, add it. you know, this used to be a remedy for diabetes long before we used medications. And what it does is it slows down the ability of your stomach to empty. It delays it so that you are not absorbing a whole lot of carbohydrate. So it makes you feel full sooner. And the studies have shown that, remember this postprandial glucose, here the term again, postprandial is the glucose after eating. It reduces this by 35%. So if you're eating a salad, if you add vinegar to it, it will reduce your, it will reduce your glucose levels after eating by around 35%. So it's very good. And it makes you feel full quicker by twofold. So add vinegar to your meals or to your salad, it's very good. Number 8, chocolate. Enjoy it. And I'm sure a lot of you like this one. It contains flavonoids, which is very powerful antioxidant. They actually did a research of this in Germany where they know their chocolates. I would like to be involved in a research like that. And basically, they gave this, you know, they documented how much chocolate these patients were taking. The best ones are the ones that contain the highest cocoa level. Unfortunately, these are the ones that are more bitter and really not sweet. So if you're a sweet tooth, you get the most benefit from dark chocolate. And the advantages is it increases your flavonoids, which is a very powerful antioxidant. And in effect, it can reduce your blood pressure and your risk for cardiovascular events. The reason why we don't recommend too much sugar is because it usually comes with sugar. Okay, so your chocolate usually comes with sugar to make it taste good. And so you get calories from sugar. So you have to be careful. Get something, chocolate that has 70% cocoa. That's what we recommend. Green tea, drink it. How many of you like green tea? Very good. And I didn't know this. It is the second most consumed beverage in the world compared to second only to water. And it contains polyphenols. And these have been proven preventive agents for cardiovascular disease. The mechanism of action we don't really know. But it might be because it's able, when they say scavenging radicals, what it does is it goes after these free radicals that we were just talking about and gets rid of it, or it may have an antioxidant effect. So we don't know what the effect is. And how did they know this or come to the conclusion that green tea was good for you? Where they looked at, you know, Japan, because they drink tea a lot, and they found 40,000 Japanese who drank tea. Those people who drank more than 4 cups per day, they're all-cause mortality. So their deaths from any cause were reduced by 12% in men and 23% in women. And the difference in the reduction is probably because more men were smokers at that point. So the benefit is seen more in non-smokers. It has no effect, as we know, in cancer mortality as it stands right now. But the patients who drink at least a cup of green tea, it might be beneficial to you. So go ahead and drink your green tea. Number 6, vitamin D. Take it. And you probably have heard a lot of things about vitamin D. The blood test that indicates your level the best is your 25 hydroxy vitamin D level. And if you haven't had a level taken because you live in Florida, think again. You need to have it checked. I have started checking vitamin D levels in my patients, and let me tell you, 90% of them are vitamin D deficient despite living in Florida. And the reason why is that God basically meant for us to walk around naked 24 hours a day. If you're not doing that, you're vitamin D deficient. If you fail to get at least 15 minutes of direct sun exposure, you are probably vitamin D deficient. African Americans, because you have the melatonin, you're not absorbing it, and so you probably are vitamin D deficient. The layer of the skin that transforms the UV rays into the active vitamin, as you get older, and older I mean at the age of 50, starts to atrophy, okay? So even if you stay out in the sun, you are not absorbing the sun and changing it to your vitamin that you need. So you probably are vitamin deficient. If you have the abdominal fat, you know, vitamin D is attracted by fat. So your vitamin D is in your belly where it's not doing anything. You probably are vitamin D deficient. Now, we are now considering vitamin D more of an hormone than a vitamin because it has significant effects. It's an anti-inflammatory. You're going to hear a lot about inflammation now because it's been linked to cancer and coronary artery disease. Vitamin D can reduce your blood pressure, it improves your bone health, it improves or regulates your immune system, and it really lowers your risk of type 2 diabetes as well. So vitamin D seems to be a very good vitamin. The future is that, the buzz around vitamin D is so loud that the NIH actually sponsored a trial looking at vitamin D in your fish oil. They want to enroll 20,000 men and women and giving them vitamin D and fish oil. And they're looking at the reduction in the risk of cancer, heart disease, stroke, and autoimmune diseases. So if you have any of your physicians who are involved in this trial, please do so. Please enroll in these trials because it's very important. And I think the information that we will gather from here, which will be available maybe 5 years down the road, is going to be very important. Number 5, cinnamon, sprinkle it. It actually mimics the effect of insulin, and it increases the cell's ability to take in glucose. It improves, that term again, your postprandial glucose. Your glucose levels after eating goes down with cinnamon. And studies support its use in diabetes as an adjunct, okay? The dose is typically anywhere from 1 to 6 grams a day. Now, one thing you have to remember is that cinnamon powder that you have contains around 4.7 grams of that. So if you put 1.5 teaspoons of the cinnamon, that should be good for your daily dose of cinnamon, okay? So sprinkle it in your oatmeal, makes everything taste good. Sprinkle it in your sweet potatoes as well. Number 4, alcohol, the most controversial. Drink it in moderation. Now, we have gone over alcohol, about it being good, being bad for many, many years. And this was a classic study that was done in 2000, looking at people who drink 1 glass of alcohol a day versus people who drink 3 or 4 glasses of alcohol a day. And you notice the mortality or your risk of dying as it pertains to alcohol is what we call J-shaped, wherein the people who had the lowest risk of dying are the ones who drank alcohol moderately, around 1 to 2, 1 for women, 1 glass of wine for women, and 2 glasses of wine for men, okay? So their mortality was actually better than the people who didn't drink. But when you increase your alcohol intake, then you increase your risk of dying from other causes, including liver problems, high blood pressure, breast cancer, more importantly. As a matter of fact, a month ago, if you were listening to the news, there was a recent study that showed that even moderate drinking, so drinking in moderation around 3 or 4 glasses a week, increases your risk for breast cancer. So what I recommend to my patients is moderate drinking is key. So 1 5-ounce glass of wine. So when we tell you 1 glass of wine, we don't mean a glass this big. It's only 5 ounces. An ounce of liquor, or we've seen the benefit with beer as well. So it's 1 for women, 2 helpings for men. It reduces your plaque deposits in your arteries. It protects against blood clots. It increases your HDL, which is your healthy cholesterol. And it contains flavonoids too, which are active antioxidants. Again, heavy drinking increases risk for stroke, cancer, liver disease, breast cancer, and congestive heart failure. So we wouldn't recommend that. Of course, if you're not drinking at this point, don't get started with it. And the other thing too is that if you have a very strong risk factor or family history of breast cancer, or if you have been diagnosed with breast cancer, it might be a good idea not to drink. Okay, but it does help with cardiovascular disease. Number 3, coffee, savor it. Again, we've been back and forth with coffee. The most recent, it's been controversial for many years. The most recent study looked at the nurses' health study and the health professional study, wherein they've enrolled thousands of patients looking at their consumption of coffee, around 1 to 6 cups a day. And the trend is that it does cause a reduction of dying from all causes. So coffee seems to be good. It also has a trend towards less development of type 2 diabetes. It has antioxidant effects. Contrary to belief, it doesn't really cause chronic hypertension, and it's safe in pregnancy. The only thing that you have to remember is that coffee is metabolized differently by different people. So if you're the type of person who, when you drink coffee or have caffeine, you have palpitations, you get headaches, coffee might not be that good for you. But if you can tolerate your coffee, go ahead and drink it. Number 2, olive oil. Use it. Olive oil, as I told you, contains monosaturated fatty acids, which are less oxidized. So this is a healthy kind of fat. It reduces your body's ability to use up insulin. It has antioxidant compounds. It has anti-inflammatory effects. And it can reduce your risk for developing diabetes by 52%. So in our household, we use mostly olive oil now. It's very good. It's very easy to use. You could cook with it. You could put in your salads. Healthy. This is a major component of the Mediterranean diet, by the way. And we think that this has a lot to do with the reduction in cardiovascular mortality. And number one, nuts, snack on it. We've seen this effect in almonds, in pistachios, and peanuts. As a matter of fact, they did a very interesting trial where they fed a group of people white bread and mashed potatoes. So with white bread and mashed potato, you expect your glucose level to go up after 2 hours. What they found out is that if you ate the white bread or you ate the mashed potato and you added a handful of peanuts or almonds or nuts with it, you reduce your postprandial glucose by 50%. Now, some of you are taking it as saying, ooh, I can eat all the mashed potato I can and just get a handful of nuts. That's not what we're saying, okay? What we're saying is that you have to eat nuts and do it around 30 milligrams a day, a handful, 5 days a week. It's good for you. It reduces your blood pressure, your fasting blood sugar, and it causes a reduction in your inflammation compared with a low-fat diet even. So it's very good. 5 times per week will reduce coronary artery disease and diabetes risk by 20 to 50%. Okay? So hopefully, I'm sure you've been tired, hearing people tell you what you can't eat, but now I'm telling you what you can eat and what you can enjoy. It really is a matter of really choosing healthy choices. And we must focus really more on the unique aspects of women's hearts to save more lives. So if you haven't had any of your screening done, just want you to know that there's a new program that Baptist, if you know anyone who does not know their cholesterol level at this point or not seeing primary care physicians, we have a very unique program, which is the HeartWise for Women program, where we do personalized screening for an hour. So we sit down with you and we go over your diet, we go over your risk factors, for a good price of $49. So if you're very interested, please let us know. Yes, HeartWise for Women program. And that's the end of my talk. So if anyone has any questions. Yes, ma'am. Yes, the CoQ10, when you are on cholesterol medications or what we call statin medications, the statin medications basically deplete your levels of CoQ10. And that's the reason why most patients will have muscle aches or muscle pain with the statin medications. So along with statin medications, we do recommend it as a supplement. Yes, ma'am. We do screens, we do your cholesterol, we do your blood sugar, we do your weight, blood pressure. So we do incorporate a lot of that. At this point, that's all we have. In the future, we're hoping to be able to offer more. But at this point, that's it. Yes, ma'am. Right. Well, almond milk, and the concept is the same. You really want to focus on the monounsaturated fatty acids. So almonds are fine. Almond milk is fine compared to the regular, milk that you have. Yeah, we do recommend almond milk, but again, in moderation, because you have to look at the calories. Some of them have a lot of fat in it. It's a matter of choosing the right kind of fat. Yes, ma'am. Right, and when you look at the Mediterranean diet, it basically is more of almost like a vegetarian. They don't recommend that you have a lot of the processed meats or the red meats. They recommend that you go with, chicken, which is the white meat, but a lot of emphasis on fish. So if you are going to go vegetarian, make sure that you have the protein in there, and fish would be a good source of protein. Yes, ma'am. Yes. Good in frying with the fish. I knew somebody was going to ask that. Yeah, no, you're better to bake it. Not a good idea. Yes, ma'am.
Speaking of that, I have read in certain things that frying or using olive oil in high heat is not as good.
Not as good because it breaks down the olive oil. The best way to really use olive oil is to put it in salad as fresh as it can. But, you know, baking or grilling with olive oil, it tastes just as good if you try it.
Coconut oil, what do you think?
Oh, no, no. Coconut oil has a lot of polysaturated fatty acids. And, I don't know where this has come from. The coconut milk, the coconut water actually has a lot of potassium in it. So and very little fat, which is okay. But the coconut oil, the type of fat that you get from it is just the bad kind of fat. I would stay away from it. The good kinds of fat are the monounsaturated fatty acids, what you find in avocado, olive oil, canola oils, even fine. So those are the good kinds of fat. Yes, ma'am? Oh, canola oil, okay. Yes, ma'am? The thing that they studied in this was caffeinated coffee. So the decaffeinated, I think some of the advantage may have something to do with actually the caffeine. But we don't know for sure. But the studies only looked at caffeinated coffee.
Carb-wise, survey that you do the creatine protein?
The C-reactive protein, we're still figuring out a way to do it. It's not available yet, but we will, we just started the program 2 months ago, but it will be available in the future. Yes, ma'am?
Are there any nuts that should be avoided, or are they often going to
The ones that we've studied are almonds. We've seen it in almonds. We've seen it in pistachios, peanuts, and especially walnuts. So, but they all contain monounsaturated fatty acid, and these are processed more easily than the polysaturated fatty acids. So I think my inclination is any nuts. Yes?
What is the recommended dosage for a supplemental vitamin D?
Vitamin D, it depends on your level. It's one of those vitamins wherein you still need to take your level. And the people who have levels, and the normal level is anywhere 30 to 70 is the normal level. If you're way down, we would recommend anywhere from 2 grams or 2,000 to 3,000 IUs of vitamin D. Yeah, to 1,000. Yes, ma'am. Heartwise, we'll give you the phone number. It's 202-KNOW, K-N-O-W. Yes, ma'am.
green tea?
Yes.
So many in the market.
Yeah. Well, all of the green teas are fine. The differences in the market is just a difference in flavoring. So they have the raspberry and the mango, but the main component is the green tea.
I thought you would recommend made in China.
Yes, ma'am.
How about drinking alkaline water?
Alkaline water, I think that concept started with just alkalinization of the blood, but I don't think we have strong data on alkaline water at this point for us to recommend it. It needs to be studied, but I cannot recommend it at this point. Yes, ma'am?
I wanted to ask, I heard something about dental care and something precursor about inflammation.
Yes. One of the things that, if you have time to go online and look at the anti-inflammatory diets, I think one of the things that's going to come out in the future is that inflammation is the root of all problems. And when you have things that reduces your inflammation, you're going to cure heart disease and you're going to cure cancer. So the inflammation in your gums is just a reflection of the inflammatory markers in your system. And that's an outward manifestation for it. And that's the reason it has been associated with cardiac events. And we've already, in the past, we thought that having a viral infection, there's lots of patients out there who had no coronary risk factors. Their only risk factor was that they had a viral infection a few months prior to having their cardiac event, or a few weeks prior to that. But we've studied giving patients antibiotics, giving patients, antiviral medications to see if it reduces your risk for having cardiovascular disease in the future, and it hasn't worked. So there's something with inflammation, and I think that that's going to be the wave of the future. As a matter of fact, we are studying drugs that target inflammation to see if it will reduce your risk for having cardiovascular events. Absolutely, yes. Yeah, and that's one of the things that we recommend, especially people who have valve problems. You have to do that.
Before we're going to have to stop now, but if you have questions, if you make sure you fill out your survey, list your question on the survey, and we will pick those questions up and get back to you. Let's all thank Dr. Rama.
Thank you. Is this for you?
Actually, who are you not to be? You are a child of God. Your playing small does not serve the community, world, the universe. There is nothing enlightened about shrinking so that others won't feel insecure around you. We were born to make manifest the glory of God within us. It is not just in some of us, it is in every one of us.